All right. Well, good evening, everyone. Thank you for joining myself, Nicole Yount. I'm one of Next Level's executive coaches and ortho specialists. And with me is Paula Quinn. She is our resident partner, hygienist, and clinical coach. We're excited to have everyone with us tonight. So appreciate those who have a time zone change and are joining us kind of late night, listening to us before you go to bed. So we'll just jump right in. But tonight we're going to be talking ortho, something near and dear to my heart. And without further ado, we'll jump right in. So again, an extended welcome to all of you for sharing your evening with us. We greatly appreciate it. I'm going to do a little bit of introduction of myself. I'll pass it to Paula to do hers, our qualifications, and then just do a brief agenda. So again, I'm Nicole Yount. I have going on now 14 years in the dental field, which is so weird to say. It doesn't feel like it's been that long, but it has. I love the industry. I love what I do, what I've done. Some background on me. I worked as a treatment coordinator in an ortho office for the better part of 10 years. I worked in 3 different practices, same company, just 3 different locations I would bounce around to. Really fell in love with the whole process of ortho and insurance and clinical and assisting, and but ultimately really love that treatment coordinator and seeing all my new patients and or getting those kiddos into a recare program. Just really fell in love with what ortho can do and really truly how it can transform lives and really boost confidence just as well as any other dental procedures that we're doing. When we're bettering our patient's life, there's nothing better. And then throughout my experience, I met Paula. We both worked for and we're speaking for Align Technology, so Invisalign, big powerhouse brand name I'm sure all of you recognize. I was a territory manager, and Paula was on faculty and was a speaker that would speak on our behalf and really tackle the hygienist and our clinical teams and talk ortho and why it's important to bring up in hygiene. And we met a few years back, and again, I was a territory manager and she was a consultant for several of my accounts, and we hit it off and joined forces. So here we are tonight. And with that, I'll pass it over to Paula for her intro.
Nice job, Nicole. Yes, I'm Paula Quinn. I'm here in Arizona. It's just turning nice here, so everyone will be jealous for the next 10 months of me and my weather.
Yes.
But pity me in the summer for sure. I am a clinical hygienist. I've been a hygienist for about, I don't even know, 28 years, I would say, in dentistry for 34 years. So sorry, Nicole, I have you beat by like 20 years, I hate to say. Obviously,
I'll get there one day.
Yeah, right. Obviously, no need to say I'm passionate about dentistry. It's literally been my life. I love ortho, what it does for patients, what it did for me. Clear aligners are the best thing that happened to orthodontics. Aesthetically pleasing, so easy to wear, all these things for patients. So I'm glad it came out because it's allowed so many people that would otherwise not invest in that treatment. And I'm sure we'll get into that tonight. But I still am doing some clinical hygiene, have been consulting and speaking for a long time now. And Michael and I joined forces, I don't know how many years ago, let's call it 5, and started Next Level. And the rest is history. It's been fun. It's amazing. And I get to help doctors and teams every single day of my life share the knowledge, share the joy, and really help elevate patient care. So that's about it for me.
Thanks, Paula. Awesome. Well, we'll jump into just a brief agenda and really what we're going to tackle here. So number 1, strategies for clear aligners. So really learning effective strategies for incorporating them and kind of the backbone of what I believe to be some of the things that I think are imperative to implement to really provide and create a consistent ortho program within your practice. One component of that is patient selection and management. Are we selecting the right patients who are suitable for clear aligner therapy? Do we know our patients? Are we reading our patients well enough to know that they're going to be compliant? in order to get optimal results. I'm really passionate, both Paul and I, about the role of digital technology and what it can do within your practice. So if you've not jumped on a scanner bandwagon, I encourage you to do so. But as long as we are using some sort of visuals, and we'll talk about the why behind that. And then lastly, we'll touch on marketing and how to kind of set yourself apart from competitors or just from people around you, and really how to make a robust, really content calendar around marketing clear aligners. And we'll touch on some challenges as well. So jumping right in, incorporating clear aligners, team training. I can't say enough about team training. Many of you docs, you go to a CE course, you go to an intensive ortho course, you have a great webinar that you're attending, and you get jazzed and excited, and you go into the practice tomorrow morning, and we're going to implement clear aligners, and your team is looking at you with whites of their eyes, like deers in headlights, going, oh my gosh, doc, one more thing, really? I'm really passionate that if you have the knowledge and the passion for ortho and you see the why behind it, that we are empowering our teams to also know the why behind it. We're educating them, and we're creating some sort of incentive around that, and why communicating to our team why clear aligner therapy from a restorative angle could really benefit our patients. Anything to add on team, Paula, there with incorporating clear aligners?
No, I mean, yes. I think it's just like anything else. You almost have to experience it and be there to enjoy and ignite that passion in the same manner. And I would say, training for Invisalign for all those years, and even being a consultant today, I think accountability is one of the hardest things. And when I go in and teach hygienists, even today, about clear aligners and implementing it, you'd be shocked at how many of them just, and they probably don't want to admit it, because obviously you're a hygienist, you went to school, you learn about malocclusion like this much. And they don't like to admit it, but they'll look at me and say, we don't even know like how to, let alone identify it. We don't even know how to talk about it. They're so afraid to bring it up to patients because, being the personality A type that most hygienists are, we're not going to talk about it unless we fully feel confident in everything about it. And I would say that's where a big miss is that team training, because they'll shake their heads, nod their heads yes, because they don't want to feel inadequate, but then they'll get into the room and not diagnose at all. And I don't know if we're going to touch on this at all, Nicole, but time is another big factor, but we'll probably get into that in a minute. But just the understanding. And we try to teach, like, it's a little bit less about, you don't have to diagnose, you don't have to tell them how long. It's really just identifying and then passing the baton. Of course, the more you know and the more comfortable you are, the more you're going to talk about it. But if we can just get them having that conversation. So
yeah, absolutely. I'm really glad that you brought that up, and we will talk about identifying those slam dunk cases. It's kind of the best way that I like to describe it, and really making it easy for our entire team, not only our hygienists, but our assistants as well.
Yeah, and it starts building that confidence, right? Because
absolutely,
slam dunks behind your belt, you're ready to go. So
absolutely, yeah. And then just that passing of the power. We know that and it goes with all procedures across the board in dentistry, if our hygiene team or even an assistant isn't pointing something out with the help of visual aid, then when doc comes in and says all of these things, it's like, well, Paula didn't tell me, Nicole didn't tell me. Really, why, doc, is that really, do I really need this? Or it's on the flip side where you're saying it as the hygienist or as the assistant, and then doc comes in and patient acts like it's the first time that they're hearing it. So it's important that we get really good with passing that power and those conversations, and we're all on the same page. All right. And secondly, patient communication. So in my experience, setting the right expectations with our patients, that's before the appointment, during the treatment presentation, and then, of course, prior to their delivery appointment of those clear aligners. if we're not setting those right and correct expectations, we're not taking the time to address the patient concerns to ensure that they're well informed and comfortable with the process, then we're going to have bumps along the road the entire treatment length. So I think that establishing a protocol around that is imperative. And the way that we do that, and the way that I recommend doing that, and I know Paula will agree, is that we come up with some sort of patient contract that we're sitting knee to knee with our patients once they do commit to treatment, and we're going over those expectations, that we're reviewing those expectations at, when we're having a checkup or a check-in to get our next set of aligners. We're pausing and asking the patients, how is your experience going? Do you have any questions? What concerns do you have throughout this process? And otherwise, what happens, and we all know this, and we're guilty of it. I went through ortho twice. I didn't wear my retainers, or the second time around, I just didn't wear my aligners because other things came up. I didn't maybe understand the expectations, even though I was in the practice. I was a newbie when I went through it the second time. So, I think it's imperative that we're setting the right expectations with our patients right out of the gate. And that goes from front office, that goes to whoever they're seeing clinically, and for a doc as well. Anything there, Paula, you want to touch on, or keep going?
No, keep going. That was beautiful.
All right. And then workflow. So integrating clear aligner therapy into existing workflow. So really what I mean by this is, are we scheduling appropriately? The beauty of clear aligner therapy, again, if we're setting the right patient expectations, if we are treatment planning accordingly, and we're getting really good with our case selection, then you don't need to see these patients every 4 to 6 weeks like you would in a traditional ortho office. If it's a committed patient, we can tend to push those appointments out 8 to 10 weeks and open up some chair time for other procedures, because we know that ortho is not the bread and butter of your practice. It's a great add-on and can really boost your revenue. And again, it's a great add to any of the services that you're doing. However, we want to make sure that we can implement and adjust workflows accordingly. So I think it's really important to understand and look at our schedule to see how we fit in those patients. Sometimes it's as simple as creating what I like to call an ortho leader within the practice, whether that's an assistant or a hygienist, somebody who wants to take it on. I don't recommend a front office person taking that on, because they're not necessarily in tune with clinical schedule and clinical flows, which we want them to be. But ideally, I like it to be an assistant who really understands that workflow and how those appointments look and how much time that they need. So oftentimes I'll help you look at your schedule and say, okay, where can we create sort of a ghost column in between all of our other columns that we're running throughout the day. Anything on that, Paula?
No, you're doing amazing.
And then visuals. So utilizing digital tools, whether, again, that's a scan, that's IO photos. I don't care what scanner you're using, but use it. I hate to say it, guys, but the old mirror and perio probe doesn't work anymore to point things out. We're such an Uberized, is what I call it. Everyone's an Uberized mindset. We want to see things and we want things now. We always have our phones, obviously, in front of our face. We're in front of screens. We're looking at images all day long. So why aren't we providing our patients with that same service? I like to say that, if I brought my car into the shop and, they tell me, oh, your brakes are wearing, you need new brakes. That's great. That's fine. That's dandy. But I'm probably going to push them off and say, okay, next time, because of the price point, next time. Now, if that same mechanic shop pulled up a 3D image of my car and said, no, Nicole, look at all this wear happening. Your brake pad is about to blow out. Well, I might be more apt and feel the urgency to get that done and figure out a way financially to get that done. I have twin boys. They're constantly, I'm Uber mom. So I care about the little lives in my car, right? So it's the same concept with our teeth. When patients see a digital image, again, or even if we're just utilizing photos, point those out, show them those visuals, and then send them home with something so that it stays top of mind. All right. And then patient selection. Okay, so patient selection and criteria, especially in my GP offices. So again, we want to identify the right patient. In a GP practice, for this to be profitable, Okay, we want to be looking for class 1, like arches, mild to moderate crowding or spacing. And ideally, we want these cases to finish in about 6 to 9 months. Why I think that this is so, if you can just wrap your brain around this and really hone in on it. I know sometimes we want to treat those severe class 2s. I know sometimes we want to take on a class 3. It's not going to be profitable for you. I highly recommend keeping your relationship very tight with your orthodontist and still referring them a ton of cases. However, when we have those adult patients that come in and we see these class 1 like arches with mild to moderate crowding and spacing, that's what I mean when I say a slam dunk case. We know that that case is most likely going to finish again in that 6 to 9 month range. Why I think it's also important and imperative that those are the patients that we're selecting is it helps my hygiene team. My hygiene team now knows what to look for. It's very easy to train my hygiene, even my assistants, on a class 1 like arch with mild to moderate crowding and spacing. It also, in their brain, it's very easy talk track for them to say, when the patient asks, well, how long is it going to take? How long do I have to wear these? Very confidently, everyone in the office should be able to say, we treat cases that tend to finish in 6 to 9 months. Boom, done, period. Everyone gets confident with that. And you then second layer, you tap on the financials to that, which we'll go over towards the end. But I think that that's imperative, is if we can get that down, and those are the types of cases that we're looking for, you're going to see your case acceptance go through the roof. And then managing expectations. So setting realistic treatment outcomes. Again, this goes back to communicating and setting those right expectations with our patients. Again, if there's going to be limitations, if we see something that looks maybe class 3, we've got some cross bites, we've got severe overjet, refer all day long. You have a massive patient pool, I guarantee it, to pull from that falls within that class 1 like arch. And then successful outcomes. We want to ensure that follow-up care and retention protocols are explained incredibly clearly to our patients. Again, or you're going to be like the classic adult patient who goes through ortho again, which is who we're trying to capture. But now as an adult, I'm going to call and I'm probably going to point a finger and blame it on Paula that my teeth didn't stay straight. So Paula, I'll let you add on there.
Well, I just, the slide before, the only thing I want to say on that is, 65% of the population is visual. So we miss a lot when we just overeducate and talk. So I just wanted to make sure that everyone understands, if we're talking and visualizing, number one, most people are visual. And number two, with the combination, you'll hit everybody pretty much. So definitely incorporate some visualization into that. And a scanner is probably one of the most incredible ways, and photos. So both of those coupled together, you can't miss. Put somebody's mouth on a big screen, and either via scanner or photos, you've got a slam dunk there. For the criteria of selecting patients, Nicole's absolutely correct. And, I do add that to my form, just finding out who has had ortho before. It's a great conversation starter for your hygiene team or even your dental assistants, of if they've had ortho before, because if I get in their mouth and I know they've had ortho and there's that mild crowding now, there's nobody more upset than the patient in your chair that they didn't wear their aligners or their retainers. So they're pretty much easy, talking about that lower anterior crowding, to enroll back into treatment. I also think just the success, obviously you're going to be less frustrated with these slam dunk cases that you can treat because you're going to have the success. I also think, just in my head, because I'm a consultant, think of the Google reviews that you're going to get immediately, rather than those 2-year cases, and they're going to be happy because you're going to be able to meet the expectations or hopefully even exceed them. So I think, that's just all, I couldn't express it enough. Start out with those mild to moderate cases that you can finish pretty quickly.
Yeah, absolutely. And to add on to that as well, Paula, thank you for saying that. When we are adding that question to our forms, again, that simple sentence is, have you had ortho before? Yes or no. If we're not re-enrolling that patient back in a treatment, well, what are we doing to retain our current state? Are we in some sort of retainer? Or are we in a night guard? So there's an opportunity, if they're not going to convert to a clear aligner therapy, to put them in some sort of retention device as well.
Yeah.
So
I think also, just even your team members that are, can experience this, whether they're someone that wants to do ortho or just put on one of those retainers. I think experiencing the wear of either of those is so much easier to talk about to your patients.
absolutely.
When you're talking about successful outcomes.
Yep. Yeah. Ask your, if you're currently certified in any of the clear aligners, ask your territory manager for a staff discount. Those are always floating around. So you can treat an office member for a discounted lab fee, which is a great opportunity too. All right. So a second layer, I really want to dive in more to the digital technology and clear aligner therapy. So, it's a no-brainer. Nobody wants an impression anymore. I still know a handful of docs who take impressions to submit for clear aligners, and I can tell you they lose a lot of those patients. And why they lose those patients if we're still taking a PVS impression is typically that case is going to be rejected. It's not as accurate. A lot of assistants aren't that great, to be honest, at taking PVS impressions anymore. We used to, because that was the only option. But now it's oftentimes you're losing those patients. Those patients drop from treatment because it needs to be resubmitted, or we got to get them back in to take new records. And now it's been a month. So you're not capturing them quickly in the chair and as effectively as you would if you were utilizing a digital scanner. And patient comfort, it goes without saying. Nobody likes that in their mouth. It's terrible. Everybody, I still gag. I mean, the last time I had to have an impression done was for my gum graft, and it was awful. It was totally awful. So, nobody likes it. Again, I can't say it enough. I don't care what scanner you're using, but get yourself a scanner of some sort. It's very, very imperative to show those visuals to patients. Again, we're constantly looking at our phones. We're constantly looking at images of different things. If you're not doing that for your patients, then you're kind of behind the boat on that one. And then treatment planning software. So most of the aligner companies offer some form of treatment planning software. Invisalign, obviously, a ClinCheck. Oftentimes, one of the biggest mistakes I see doctors do is they get certified, they're jazzed, they get their first cases submitted, and then they get the ClinCheck back and they say, well, it turned out terrible. It's terrible. Invisalign is not going to work. This doesn't work. You have to remember, okay, yes, it's AI, but you are still the doctor having to make certain adjustments to those teeth. So get very confident and familiar with that treatment planning software and how it works. Because I can tell you, I've seen crazy simulations come back on the simplest cases. And it's just a matter of we didn't know how to utilize the software to our benefit. Anything there, Paula, to add?
I was going to say, I don't know. I bet you didn't think digital x-rays were going to be a thing, intraoral cameras. I mean, when technology comes, it's here to stay or advance. So it's the way of the future. And I know that the more and more patients get educated, they're going to be looking, just like they now are starting to look for certain lasers and different things like that. They're looking for same-day crowns. They're looking for not to have that goopy stuff in their mouth either.
Absolutely. And one of the first places that they'll look is on your website. So if you're not promoting yourself as being a tech savvy office or having some sort of scanner or a laser, they're going to pass right on and go to the next one, because it's likely that their friend, their relative had a scan somewhere and they've been talking about it. So absolutely. And then our patient engagement tool. So with certain aligner companies, patients will be able to access their records, their progress, their engage with you via apps and different platforms. So again, oftentimes I see where that service is available and nobody's taking advantage of it. So your patients, again, remember, I can't say it enough. They're always on their phone. They're always looking at things. There was a study that was done, and I don't have the exact numbers, but compliance with clear aligners in teens went through the roof when they were able to access the app and communicate with their doctors through the app, because they could text their doctors, they could, and their doctors would text back, and they just thought that was so cool. So it's very interesting that's kind of a miss, really across the board that I see in utilization. So, and then lastly, enhanced patient experience. Really, it's going to foster a better communication, that two-way conversation with the hygienist, with the doctor, utilizing technology and those visual tools. I mean, Paula, wouldn't you agree? It makes your job 100% easier when you've got the visual right there. It makes it, the patient can't deny it. It's right in front, smacking them right in the face. Like you said, you put their teeth up on the big screen. Oh, this crown you've been telling them to get done for years and years and years, and they keep fluffing you off. Well, you put it up there and we start talking about it and slide that magnifying glass and zoom in. It's going to be a different conversation. So
one thing I love about the treatment planning software, or some of the aligner companies offer a tool where that really engages the patient and tells them like when to change their aligners and like things like that. So, it's kind of fun because they forget, they need a reminder. I mean, I suppose you could put it on your calendar, but I think when you have that interactive tool, it's like a lot cooler and they like it. So
yeah. Yep, absolutely. It's the cool thing to do. It's what the cool kids are doing. All right. And this is where I pause for a minute and pass it over to my resident hygienist here to talk about the importance of discussing clear aligners when we're in our hygiene appointments. So take it away, Paula.
All right. So it's really super important for your hygienist we've already established that, to be able to talk about clear aligners and what it can do for your patient. We used to think of ortho as an afterthought. It was kind of like, oh, and your teeth are really crooked, you need braces, and it also was more of like an adolescent or teen thing. And now it's become part of comprehensive care. So I just feel, not to, that's what you're here for tonight, is to learn. And I think that we're missing the boat if we're not having these conversations with our hygienist that can have it with our patients, because it really should be part of comprehensive care. In some philosophies, including mine, sometimes I even let's do clear aligner therapy prior to even doing any kind of treatment, because when teeth are leaning in or in any which way, our approach to some kind of restorative is going to have to be more aggressive than if we put those teeth in proper alignment and then do that. So it's always part of ensuring that they have comprehensive care. It's always that. If we're putting not a night guard at the end of ortho, but a night guard on, or we're doing things like that, sometimes we're missing, those are Band-Aids, and we're missing that comprehensive care. So we want to make sure that we're always addressing that pre-restorative prior to doing that comprehensive care, or the clear aligner therapy. Now, everybody gets to make their own choice, but the only thing that we can do is educate. So if your patients are fully educated about the benefits of clear aligner pre-operative, and then they choose just to do Invisalign, aligners, any kind of Invisalign, Clear Correct, all of those out there, then, that's their choice. But educating on that is the most important. I also think if you're an office that is really into veneers, more cosmetic restorative, I think it can save a lot of tooth structure. Sometimes at the end, we may not even need restorative. However, I doubt that happens very often. I mean, usually, it's the color, it's the discoloration, it's different other things that are leading us to wanting those veneers. But I do think it's a service that we can add and make patients really happy if we are able to put the teeth in the right position. And then at the end, maybe they like them so much that, it's not something that they want to move forward with. It's okay, because we're going to get an amazing Google review out of that. And they're going to tell other patients how amazing it was, because not everyone can get away with aligners and then not need any restorations. And then really it should just be part of your everyday care as a hygienist. I like to take scans and records and really talk about this as part of comprehensive care, because as a hygienist, we miss the boat a lot when we're diagnosing periodontal disease or gingivitis. And if I don't know if there's any hygienists on here tonight, but even dentists clean teeth, that you're hitting your head against the wall because you're doing everything for this patient when it comes to perio. You're seeing them every 3 months, you're doing their periotherapy, and over again, you're just not seeing improvement. But when you have a bad bite and you have teeth colliding together, you're really never going to get the result you're looking for, because you're destroying that structure around that tooth that's going to keep it healthy. And so at the end of the day, until we get those teeth in the proper position and the bite in the right position, they're going to continue to have those gum issues over and over again. Not to mention, I mean, we can all relate to those lower anterior crowded teeth where we're scaling every 6 months, trying to be a hero and help them have good hygiene, and it's almost impossible. So when we can talk about the overall improvements and outcomes of where, maybe they don't have to get their teeth cleaned as often, or they don't get the buildup. And even more significantly, we can save their teeth for a lifetime by getting them the right position and not having all of that bad bite or that bad positioning that's causing damage. So I got very clinical there, but I'm hoping there's a lot of dentists and hygienists on here. Yeah. Anything to add to that, Nicole?
Yes. No, thank you, Paula. That was great. So, yeah, I mean, I think it's just educating and, again, empowering our hygienists to have conversations from that pre-restorative lens. And again, with those visual aids is really what's going to help that two-way need-to-need conversation. But really expressing to the patient that I'm not trying to sell you clear aligners. I want you to be in clear aligner therapy, because to Paula's point, we keep having you in here for that lower anterior crowding every 6 months to clean. And we're in the same boat, and we're having the same conversation every 6 months. And I tell you every 6 months, Mrs. Paula, that, hey, clear aligners are still an option for you. But I think it's taking it a step further with our patients and just saying, hey, ultimately, this will end up saving you money. If we get those teeth into proper alignment, you're not going to have to come in every 6 months for these deep cleanings or whatever it may be. Really explaining to them and adding some sort of cost to it, not necessarily adding a dollar amount or explaining and any of that, but just simply saying that if we get this malocclusion or your bite corrected, really it allows me to properly clean your teeth. And then two, for our dentist, it helps for those restorations to last a lifetime, which is ultimately what we want. So thanks, Paula.
Of course.
I mean, one thing to touch on though before we move on, can you address just the pushback of time to talk about ortho or to take a scan? And because we hear that all the time. I don't have time.
Yes.
I hear it all the time. It's the number one thing I hear in all my offices, and my pushback from my hygienists and even my assistants. I don't have time to take a scan. I don't have time to talk about ortho.
Right. No, it's definitely, honestly, an everyday conversation with hygienists. So first of all, Nicole would agree with me on this. We need to alternate the scan with x-rays. Like we never want to do those at the same time. So we get really creative once we understand the additional things that we have to do during a hygiene appointment. I could go on forever about this, so just stop me when you need to.
No, go on, preach it.
So we always want to alternate. Obviously, that first new patient exam, we're going to hopefully do the perio charting, the scan, and the x-rays. So that's going to be a little bit longer appointment. And then what we do is get really creative. So the next 6 months, even though a patient doesn't need a perio charting, I'm going to go ahead and do it so that I can start alternating things. And you just work your way through that. I think probably the other thing is always do it at the beginning, because we can make up time at the end. If we try to wait to the very end and the patient gets long-winded or the doctor takes up too much of our time with their exam, that's going to be one of the first things that goes. So for me, my assessment is the most important thing I do, which, may include x-rays, may include intraoral camera, definitely, including the perio charting, the scan, things like that. So now those are the things that are probably the most important in my exam. And so I now have to figure out, how do I rotate those and fit those in? And I have to do them at the beginning so that it doesn't get left off, because that's where I'm educating my patient. That's where I'm rolling my patient, whether it be doctor with restorative or some kind of different modality of a cleaning. So I need all of those to really, truly treat my patient the way they need to be treated. So that's number one. The second thing, which, is a little bit on the consulting side, but really we don't have to wait until the end for a doctor to come in either. And if we're doing a cleaning, a true prophy, longer than 20 minutes, it's not a true prophy. So there's a lot more to that. Hygienists, sometimes we feel like we have to be heroes and we have to do it all in one appointment. What I would tell hygienists out there is, maybe you just need to see the patient more frequently. If there's that much going on, maybe it's not an every 6-month patient. But you really are missing out if you don't take those records in the beginning. Number one, it's going to be the first thing that goes. Again, I've already said that. And then the second thing is, we can make up time because we now know what that assessment and exam phase all time took. And now we can make up that on the end through changing something else that we're doing. I don't know if that's what you were looking for, but
yeah, absolutely. And I think another reason for taking those records at the beginning of the appointment is that it's sitting right in front of their face.
Yeah, exactly.
Right.
The whole
And
time.
the patient's staring at it.
Yeah. I'm using it for education the whole time, right?
Yep.
It is my visual. Perfect.
Yep.
Yes.
Yeah, absolutely. And I love when I'm doing in-office observations and I go in and a hygienist or an assistant will take the scan. They'll put the scan up on a monitor. They'll push the scanner over to the patient, and they'll just walk away. And oftentimes the patient will either start taking photos of it with their phone, or they'll start trying to move it around themselves. So they're wanting to know what's going on. Oftentimes they're craving that knowledge too. So I think doing it at the beginning of the appointment, and the longer it sits there in front of their face, is just going to ultimately lead to case acceptance, just sitting there staring at it as well.
See, you're a treatment coordinator. I'm a hygienist.
Exactly. Yep. That's where the sales part comes into. Yep. I want it blaring there. Yeah. Perfect. Thank you, Paula. Okay, marketing. So marketing clear aligners. Again, just identifying your target market, but really it's anybody. Anybody can do clear aligner therapy for the most part. But really, who are we wanting to target within our practice? I would encourage you as a GP. Can you do teens? Yeah, you can. But do we want to save that for ortho? Probably, because remember, I said it's important and imperative that you keep that strong relationship with your ortho, and you do have that adult patient pool. I guarantee it within your practice that has that minor relapse from ortho before, or just that mild to moderate crowding that we can treat. And again, those slam dunk cases. So who are we wanting to market to? So understanding your patient demographic and then just tailoring those strategies accordingly. I really like to utilize a marketing calendar. And either having somebody, if you've got a marketing service or your IT people, your website people, whoever it may be, either you test them with that, or again, you just have a point person within the office, whether that's, again, going back to your ortho leader, you appoint them to do that. I think an effective way is to come up with a content calendar of, we're posting this on this day, and it's going to be a clear aligner quote. We're posting before and afters this day. We're doing a patient spotlight this day. We're doing, whatever it may be. In fact, we do this for our consulting company. It's the same thing. We each have a different thing and a content calendar and things that we're bringing to the table to post. So I think that's the easiest internal marketing effort that you can do to get your brand out there. And then also, I think it's important to even do what I've run a bunch of clear aligner days and promotional services where you do it once a year, twice a year, and you're offering some sort of promotion off of your clear aligners for that one day or that 1 week. Really tends to drive a lot of patient and case acceptance. It's fun for the office. It's a little bit of work. You want to give yourself about a month runway to really prepare for it and really call all those patients and do some mass marketing, emails, phone calls, mailers, anything to capture those patients. But it really can be a great revenue generator and a quick revenue generator, especially if it's something that you're just introducing. So if you do go to a course, if you're not already certified or you're not practicing any sort of ortho in your current practice now, then kick it off by having a clear aligner week and really hone in and drive that initiative with staff. And that's something that we can help with. There's kind of an art to it, but once you do it once, offices do it every year. They get really creative and they make t-shirts and they make customized cookies, and it's just all clear aligners all week or all day long. That's all it is. So anything to add on marketing there, Paula?
No, well, yes. One thing I would just say, I was actually talking to a dentist last night, and I will say if you aren't marketing it, they may go down the road, because if they don't know, and they really want it, for some people, it can be kind of uncomfortable to bring up as well. I don't know why, because we're in dentistry, it's pretty easy. I want orthodontics. But I think for some patients that maybe don't have, maybe, they just don't know how to like bring it up that they want it. So I think having it, number one, opens up that conversation for people who may be a little bit more embarrassed to ask for it. But I also think that you would be shocked at if you don't have it, they're Googling it and they're looking for a doctor who is marketing it, and they may still come to you for cleanings and stuff, but they'll walk in one day with clear aligners and you're like, what the heck happened? And
yep.
You're so mad at yourself because they're like, oh, I didn't know you did it, so just make sure, like Nicole said, that it's kind of everywhere, and have fun with it. It is fun. Patients, when they have a great experience, we'll talk about it, and they'll have a lot more confidence, and it can be a very fun video or testimonial for you.
Yeah. And that was a great point, Paula, because again, I've worked with several offices. It's the same. That patient walks in clear aligners, and the doctor does clear aligners all day long, or is certified and has been for years. And doctor's going, oh my gosh, why didn't you ask me? And it really goes back to rewind, a few slides. It goes back to having that conversation. Are we having a malocclusion conversation in the chair? How else are they going to know? So I think it really starts there. It starts with yes, marketing yourself, but really it starts with those conversations. As simple as first step is putting it on our patient intake forms. Have you had ortho before? And addressing that. And start simple. I always say, when you're incorporating an ortho program or trying to build an ortho program, start small. And what I mean by small is let's incorporate that one thing and get good at it. And Paula and even we coach this way on the consulting side. Let's focus on one thing and hone in and perfect that one thing before we're moving on. So maybe that first thing is putting that one line, have you had ortho before? And then coaching and teaching our clinical staff and even our front office on how to have a conversation and bring it up simply based off that question. Have you had ortho before? Yes. Great. Did you wear your retainer? You can make it fun. Did you wear your retainers, or did the dog eat them? Right. That was the most common excuse. But it starts that conversation of, oh, have you considered, does anything about your smile bother you? Is there anything you'd like to change or address today? Simple questions like that. But I think if you start there and keep building from it, you'll start to see that it all kind of becomes this robust program relatively quickly. Okay. Oh, and then the last to hit on with marketing, before and after photos. I see a lot of practices kind of steer away from this, but I think that before and after images, especially with clear aligners, it's a simple, I want to see a before and after with when I did BioClear, right? What's it going to do for me? Or for Botox, any of those cosmetic procedures, I want to see before and after images. So don't be afraid to take those, to post those. I think that they're important and imperative, and getting testimonials from your patients as well who have had a great experience. So, all right. Okay. So common challenges in clear aligner treatment. So again, unfortunately, I wanted to call it the 3 C's, but relapse, I couldn't think of a great word for relapse. So, but really compliance and case selection and relapse. So, I put this graph here, compliance, and really, again, why isn't my patient being compliant? And we know that all of these things can be going on within our patient's head while we're trying to explain this compliance contract with them, or instructions on what they need to do while wearing these clear aligners. So Have we given them all the knowledge? Attitudes towards medication. Obviously, we're not medicating for clear aligners or attitudes to disease, but it's just again the mindset of why we tend to fail on compliance. Health, friends and family attitude, a previous experience. So maybe I always hit on this one too. Maybe your adult patient, Paula, went into an orthodontic office or a different GP practice years ago, and they told her that she wasn't a candidate for Invisalign. That was very, very common. Maybe she wasn't. And she wasn't, right?
I wasn't.
See? And that's probably changed now with all of the advancements within the plastic and again, the softwares, different things of that nature. And now she's able to be treated in a GP office within that scope. So it's having that conversation with your patient. So again, bringing it up and letting them know that, yes, we do offer it. Yes, you are a candidate. If you're not, I'll refer you accordingly. So remember that those patients may have had a different experience or have been told no, that they weren't a candidate before in previous offices and have never brought it up again. And then their current state of mind, is it the right time to really talk to our patient about clear aligner therapy while they're in the chair or read your patient. So I did last week. I was part of a presentation, and it was great. The doctor did these role play videos, which were awesome. But it was showing again this very thing, compliance, and she was trying to talk to the patient about doing clear aligners, and the patient just seemed agitated, seemed distracted, and of course didn't hear anything that she was saying. At that point, that's not a conversation we want to have in our chair. We'll capture that patient next time. I don't think we have to feel like we need to capture every single patient every single time. It's not going to happen. We know that. So read your room, read your patient, read their attitude towards treatment, read their body language. Are they needing to get out of there? Have we ran over time? And make note of that accordingly to bring up at the next visit. So, and then treatment complexity. Do they understand? Again, do they understand the complexity of their treatment? Again, we're not treating complex cases, but do they understand, again, the why behind it? So again, it goes back to with compliance, setting those expectations with the patients out of the gate. And your case selection, really that falls on you, docs. It's class 1 like arches. I can't say it enough. Or should you refer this case? If you want to get into treating complex cases, I highly, highly, highly encourage you to take additional courses. It gets too complicated. I've seen it time and time again where my docs take on crazy cases and their ortho friend ends up finishing them. So again, let's make this profitable for our practice. Let's not, I always say your sweet Paula, who's been the greatest patient ever for years and years and years, you put her in ortho and all of a sudden she's a pain in the butt because now she sees every single little thing. And why is this space opening up here? And now why is it, so I think it's really imperative that, again, we're keeping within that 6 to 9 month range. And that's something we can help navigate and show you how to talk to and identify. And then relapse, again, goes right back. Have we set the right expectations with our patients? Have we sat them down and talked to them that retention is for a lifetime? Retention is not for 6 months. Retention's not for 1 year. In fact, it's recommended now that we're changing retainer out annually, just due to wear, due to the flex in the plastic. That's with any retainer that you're going to get out there. There's naturally always going to be flex in the plastic after about that 12-month mark. So it's imperative that we are changing those out annually. Anything to add on compliance, Paula?
It's just funny that they didn't always know that,
Yeah, I know. I
know so many people that didn't even get a retainer.
Yeah.
So it is great that now we know. And I was thinking that you could just put collapse there, like instead of relapse.
Yeah. Oh, that's
what usually happens. No, I'm just kidding. It doesn't always collapse though. No, I think that, that those are 3 amazing points. And I can't say enough about relapse and retainment for life. So
yeah. And I think that goes back to, again, it's I know I harp on it, but it's the knee-to-knee conversation. We're looking our patient in the eye and we have some sort of compliance contract or retention contract. And oftentimes I like to send them home with a little kind of cardstock postcard or laminated, just so they know Hopefully they keep it in their bathroom. I still have mine from the ortho office. So and I know to wear my retainer every night, but still it's kind of a nice reminder and to have in my bathroom. But yeah. And again, you have the patient's initial off on that relapse contract. It's also a second layer that kind of saves you if that patient doesn't wear their retainers and they're coming back to you in 6 to 9 months saying, well, my teeth are crooked again. They're right back to where they were. And you can say, well, Mrs. Paula, did you wear your retainer? Yes, I wore it full time, day and night. And we know that's probably not the case. And we can refer back to that contract. So, all right. So financial considerations and pricing. I have to tell the funny story. I've told this before, probably ad nauseum. However, it's one of my favorite stories. When I was consulting in one of my practices, the doctor, she presented her own treatment fees. So that number one, doctors, don't present your own treatment fees, please. And she brought the patient, she had recommended clear aligner therapy. And she brought the patient probably 5 laminated pages and a dry erase marker. And she said, okay, go through this and circle which one you want. And of course, that patient has no idea what they're looking at. They have no idea what any of this means. It's too much. It's overwhelming. I hope that doctor isn't on here now. If you are, doctor, please stop doing that if you haven't already. That said, we want to make this easy for our patients, but it goes back to, again, we want to really get really confident with everyone in the office being able to say, we treat cases in 6 to 9 months in our practice. The cost is generally about $5,000, just as an example. Paula at the front will go over your insurance benefits accordingly, but it helps to really get that conversation down and have our clinical team comfortable saying just that. I don't want them saying any more. I don't want them getting into any more of the weeds, but being able to confidently say, as Paula's in the mouth talking to the patient, and the patient maybe brings up, and after they've seen their scan, we've talked a little bit about ortho, and they're going, well, how much does it cost? How long? Then Paula can say, we treat patients in 6 to 9 months. And the general cost in our practice is $5,000, but Nicole at the front will go over what your insurance covers. She's the expert on that. And then again, we're passing that power off to whoever is at the front desk. Hopefully we're walking them out and we have our treatment plan ready to present. But you'll see here listed, this is an example of an Invisalign quote that I drafted that I like to use. So some of the verbiage you'll see in here, Vivera, lending point, that more pertains to Invisalign, but we can customize this however you'd want it and whatever you'd want it to say. One of the things I like to point out when I'm going through the financial is what it covers. So oftentimes I see an ortho quote and it's got a ton of insurance codes, and that's all it says here. A patient doesn't know what those mean, and they're going to ask you, well, why are you billing me for this, that, and the next thing? Simply write out what they're getting. They're getting their comprehensive ortho exam. Okay. They're getting their diagnostic x-rays. They're getting their digital scan. The fee includes all of their aligners. It includes all of their visits. And then I'm hoping that you're wrapping in retainers and some sort of whitening offering typically at the end of treatment. It just makes that $5,000 to $6,000 price point within our GP practice is a little more palatable when you're able to offer all of those things and highlight everything that they're getting within that treatment plan. And then of course you're going to reflect their insurance and then their investment. And then option one that I like to do, again, I really follow a 3-tiered pricing option. I think it's simple for everyone in the office. And it's simple for patients to understand. Option one, payment in full. Typically a 3 to 5% discount is offered. That's common in ortho practices. My GPs tend to not really like that and will offer somewhere between more of the 3% mark. But just know that if your patient walked into an ortho practice, that typically they're gonna be offered that 3 to 5% discount if there's payment in full. Option two, I put a wide range here because I've seen everything, and you'll hear different things from different territory managers, from different consultants, but $300 to $1,000 down to start treatment with monthly payments throughout the duration of treatment, with that last payment to be collected prior to the retainer delivery appointment. We want to cover our lab fee as much as we can. However, typically what we've seen and what we know within practices is our patients care about one of two things when we're looking at from a financial standpoint, and that's either a low monthly payment or a low down payment. So the other option there would be third party financing, and our consulting firm, we really love Cherry. We think it's a great option for patients, but there's so many out there. And I say, as long as you have one, great. I've seen practices who don't, and they've got stacks and stacks of paper and different months of days of the month that the patient is circled, and they're running credit cards on the first, the second, the third. Don't do that. Don't do that. Utilize third party financing for those patients, and I think that you'd be pleasantly surprised. So if anyone on here does want a referral for Cherry, we can get you in touch with someone. And that's not just for ortho, that can be for any of your procedures. Anything to add on financial, Paula?
No, I don't think so. That was beautiful.
All right. So we're right about at time. So thank you guys for hanging on with us. So I just want to summarize, really, we want to incorporate these certain strategies, and these are strategies that I feel are imperative, that I've seen are the most important when we are considering building an ortho program within our office. And when I say a consistent ortho program, I see a lot of this with ortho, where we have huge ebbs and flows, and where we'll treat 10 cases and then we go 6 months and we treat one. So really the point is utilizing these strategies and implementing them to create consistency. So that goes back to patient selection and management. And again, digital technology, utilizing some sort of image for those patients when we're talking ortho or any procedure in our office, and then some effective marketing techniques. And then our important takeaways, where it includes the significance of team training and patient communication. Those, number one, doc, if you're going to any sort of course, which again, I highly encourage you to, because I know your stint of ortho in dental school was about as big as Paula's was. So I highly encourage you, outside of any certifications, to go to a clinical course. That's not something I can teach you. That's not something Paula is going to teach you. That's something you need to go and really understand the biomechanics of movement and malocclusion. So do that for yourself. It's a great investment. And then third, so implementation and adapting workflow. So creating what makes sense within our schedule and how to incorporate that in our day-to-day, so it doesn't seem so overwhelming or our schedule's getting bogged down with these stinking ortho patients. And that also goes back to not being afraid to push those, as long as we're having those compliance conversations, pushing those patients out and seeing them every 8 weeks versus every 4 to 6. And then again, leverage digital tools all day long for treatment success. Next level consultants. So what we can assist your practice with is just providing resources, training, and support with incorporating this effectively. We've done it a million times. It's a 6-month course, which we'll dive into here on the last slide. And then utilizing successful case studies and marketing strategies. So again, this is just to build your reputation, and why I mentioned using those before and after photos and not being afraid to post those in your office with patient permission, of course. And I think you have to cross out the I's now and some certain things, but show your patients those before and afters. Be proud of those cases. Anything to add for summary, Paula?
No, I think the only thing I was noticing, and I meant to say it actually earlier and I forgot, is when, with that workflow, if, one thing we're big on at Next Level is having that morning huddle and identifying specific patients. What you don't focus on doesn't grow. And so just making sure that you're being super intentional in your day. And, you don't always know your patients, especially the new ones, but, we pretty much know our existing patients. Us hygienists definitely know which lower people are coming in with that severe lower crowding anterior that we dread all the time. So they can be a great resource in that morning huddle and helping identify who, it's a great way to start when you're implementing ortho for the first time in your practices. Let's just identify a couple people today and focus on those, if that's the best way for you to start. So just, don't underestimate the power of that morning huddle.
Yeah, absolutely. Absolutely. Identifying those patients and like Paula said, just identifying those 1 to 2, start small, start bite-sized, identify who we know. We all know off the top of our head. I can still think of patients I wish I would have talked to. And that was now, gosh, I've been, I guess, out of the actual practice and treatment coordinating now for 6 years. That seems weird. All right. So really how Next Level can help. So we offer a comprehensive 6-month ortho program. What we do is, and again, we can take this one off and offline to talk more in detail about it. But it's a practice opportunity assessment. So I want to look at inside your practice and see what we have, see what we're working with, look at the demographic, look at some of your records, see who we've got that again might fit into those slam dunk cases who we haven't talked to. We do in-person team training. Again, I can't stress enough having your team behind you. It can't be a one-man show. It's got to be, we got to have our team behind us talking about it, excited about it, and educated on it. We touch on billing for insurance for ortho procedures. You can now bill for digital scans as well, which is something I can help with, and marketing your clear aligners, and again using those digital tools for case acceptance and how to talk to them, because a lot of times we'll take a scan but nobody knows how to talk to it. Nobody knows how to utilize those tools that are available. And then lastly, really what sets us apart is I like to say we're a team meeting your team. So it's not just a single consultant coming in to help if and one man to 6 or 7, however many are in your practice. We truly have a one team mindset and have an expert, as you'll see, and really in what I like to call every department of the office. So Paula, our clinical, myself, more front office and treatment coordinating, Michael in marketing and kind of that business acumen. And then we have a front office coach. We have an HR specialist. I mean, we've got everything really, again, meeting you toe to toe with your practice to help support from really everything that you face and encounter day to day. So we'll send this out and get in touch with us. Let's talk more about how we can help, or just any questions that you have. I'm happy to answer as well. So Paula, anything to add?
No, I think it's great. I think it's just time. If what questions do you have, you can put them in comments, or
Yep.
I don't know how this platform works. So then can they speak? I don't know.
No, I think it's yeah, if there's any questions, we'll take them
you
now.
can put them in comments, or you have Nicole and I's email here. If you want to take a picture, you certainly can reach out to us via email, and we can do some conversations that way.
Yep, absolutely. And I think I'm frozen. My computer's tired of hearing me talk. There we go. Okay. Yeah, anyone have any questions, go ahead and put them in the chat. Otherwise, snap a picture of this, and we're happy to have a conversation offline. And then you'll be getting a feedback form.
It's a little.
Yep. Oh, did you put it
at the bottom?
Perfect. Okay. I hope everyone can see that. Looks like it. Yes. Okay. Perfect. So once you fill out the survey form, you'll receive your CE for tonight. And again, thank you all for joining us. Thank you, Paula, for all of your wonderful and expert insights. And I had a good time. Hope you guys did too, and can take some learnings back to the office tomorrow.
Yeah. And thanks for leading us, Nicole. It was great.
Absolutely. All right. Good night.
All right. Night, everyone.
baby. So I stand up and speak just my mind. Oh. You're channeling wind and rain. You're some kind of butterfly. Baby, you give me midnight. You whip up my appetite. Don't leave me high and dry. Baby, you give me ice and fire. You're channeling wind and rain. You're some kind of butterfly. Whip up my appetite.